Today's video we're going to be talking about knee pain. Pain in the knees is often down to general wear and tear, but there are different components of the knee which may be causing you problems. So in today's video we're going to look at the general anatomy of the knee, discuss most common causes of pain and potential treatment options. So if your pain is severe, it's always best to consult with a doctor. The knee is a joint that connects the bones of the upper and lower leg. It's the largest joint in the body and it's vital for movement of the legs, especially for certain movements like bending, jumping and running. Let's look at the anatomy of the knee. So, the knee is formed by the connection of several bones, muscles, tendons and ligaments. The tibia is the bone below the knee, the femur is the bone above the knee. The patella, which is also known as the kneecap, sits in front. The head of each bone meet and they are covered by articular cartilage, which is a smooth material which reduces friction. There are two thick pads which cushion between the tibia and fibula called menisci. They're made from cartilage and act as cushions to reduce friction and pressure. The fibula and tibia are connected to each other by two ligaments which are strong bands of tissue, and they're called cruciate ligaments. The two ligaments cross over each other like an X. The first is called the anterior cruciate ligament, often abbreviated as the ACL, and this ligament stops the tibia from slipping too far forward. The second ligament is called the posterior cruciate ligament, and often abbreviated as PCL, and this stops the tibia from slipping too far back. There are also ligaments on the sides called collateral ligaments, which limit side-to-side movements of the knee. And now, in order to secure the patella in place, you have this quadricep tendon on the top and the patellar tendon located underneath. Now let's talk about the four main causes of your knee pain. So the first most common one is arthritis, and although there are a few different types of arthritis, the most common is osteoarthritis. Osteoarthritis is this degenerative process where the cartilage starts wearing away. It's often affecting mainly middle-aged or elderly people, but other contributing factors include being overweight and repeated injury. Rheumatoid arthritis is another type of arthritis where there's inflammation in the joint, and this inflammatory process is what breaks down the cartilage and causes it to get destroyed. Arthritis causes pain because of the increase in friction between the bones because of the cartilage wearing away. The main treatments for arthritis are lifestyle changes. So gentle exercise, swimming is very good to help reduce the pressure load on the joint, physiotherapy and certain medications. It may also be required to take routine painkillers as well to help settle the pain down. Other causes of knee pain could be a sprained knee ligament. Usually this occurs from trauma to the knee or twisting it awkwardly. The symptoms of sprained knee include pain, swelling, a stiff joint and difficulty walking. A sprained knee ligament, if mild, often tends to heal on its own. It's advised to rest, keep your knee elevated, take painkillers and apply warm compression over the knee to increase blood flow to the area. Tendinitis often occurs from injury during sports, overuse, excessive jumping, and the patellar tendon is most commonly affected. It tends to heal on its own with rest, massage and heat, however repeated movements while the tendon is inflamed may delay the healing process. And lastly, we're going to talk about a torn cartilage, and this can be where there's some kind of trauma to the knee which tears the menisci, and the menisci, like we said before, are cushions and shock absorbers. So if this cartilage is torn, then a brace might be required which limits the movement and helps the healing process. It also helps to protect the knee from further injury. Depending on the extent of the tear, surgery may be needed for the repair. So we've made it to the end of the video. If you found this video useful, it's just a brief overview of the knee anatomy and various knee issues. If you found this video useful, leave a comment below. Make sure you leave the 100 emoji so I know you've made it to the end. And thank you very much for watching.